All right, guys, we're back here on the Fox 5 Live Zone. Well, the connection between testosterone and well-being, it's a lot weaker than people actually think. Earlier this week, I got a chance to sit down with a doctor to discuss just that. Of men and is crucial for understanding overall well-being. Joining us now to discuss this and so much more is Dr. Eugene Lipov, researcher, author, board-certified medical director, back here on the Live Zone. Dr. Lipov, always good to see you, sir. Welcome back to the show.
Thank you, Guy, for having me. I appreciate it.
But of course, this is a serious topic and something that we really wanted to make sure that we addressed. In this case, all things surrounding testosterone and or the lack thereof, and that being aligned with perhaps mortality risk. Do tell.
Yeah, so it turns out overall mortality, meaning death from all causes, can be as high as 88% higher if a man, we're just talking about men today, 88% higher in men who have low T, which is, if you think about it, that's a pretty big number. It also has other impact. So low T is associated with 4 times the rate of depression. It also increases the chance of suicide, which is, if you think about it, that's mind-boggling to me. Considering I'm older, I'm on testosterone supplements, I'm very interested in this topic.
Yeah, so I'm curious, and with that being said, we can also see, at least according to my notes, that this could really lead to a heart attack and or a stroke. I guess my question to you, sir, is at what point should one become aware of his testosterone level? And obviously something that's top of mind and one should be concerned about if it could lead to all of this.
Well, absolutely. I think the key point, we live in a time where we can test it. So let me just give you a very broad overview. I think testing testosterone probably is a good idea to start doing at 40 years old. So I've seen men in their 30s have low Ts. And unfortunately, we're starting to see low testosterone in a number of populations. A lot of them are young people. Part of it, believe it or not, excessive phone use and not being able to sleep produces inflammation and reduction of testosterone. But as far as testing, it's very important to test testosterone. There are 2 basic tests you need to check. One, total testosterone. A lot of people test that. But the part that does the job actually of testosterone is free testosterone. So if you are going to test testosterone, make sure to check total and free, because the free testosterone makes all the difference. Because you may have plenty of testosterone, but if it's bound up in blood, it's not doing you any good.
So anything that we can look to and or look for with regard to symptoms leading up to, well, really a deciding factor as to whether or not one is suffering from low testosterone?
Sure. Well, unfortunately, they're not really totally specific. But here's some of the things to think about. If somebody's fatigued, if they're depressed, the libido or sexual interest is reduced, sleep dysfunction, and they have suicidal thoughts. Those are very non-specific symptoms. But what you want to do is you want to make sure it's not testosterone, because as you absolutely correctly stated, low testosterone can lead to strokes and heart attacks, right? As well as depression, as we just talked about. So you need to rule this out as a first cause, because replacing testosterone nowadays is extremely easy. The best way to do is injections, I think. There are other options. But you have to keep in mind that it's a relatively easy thing to do, as opposed to, I've seen some patients who had low T, which was not checked for, and they were placed on antidepressants. That's really not the right approach. If you find an underlying problem, you can fix the underlying problem, right? But also, you have to remember that, for example, our veterans, unfortunately, a lot of them have very low testosterone due to being in battle, lack of sleep, intense tempo of deployments. All of those things lead to low T. So especially in veterans, I think testing should be done early. And again, total and free testosterone. Those are very important.
Yeah, Doctor, you made mention of veterans, and I'm curious and or perplexed as to why they are, with regard, at high risk.
Well, so here's a basic thing. So a lot of times when you're a veteran or when you're deployed, you don't sleep. If you don't sleep, that causes inflammation. Inflammation suppresses production of testosterone. That's one. Two, again, being in the military and being deployed or even training, which is very intense, like boot camp and things like that, increases cortisol. Cortisol has a feedback loop to testosterone. Also, the diet typically is not the best when you're deployed. So some of the dietary stuff could be also a problem. But again, stress, intensity, all of that. The other big symptom of testosterone, especially as you get older, is called sarcopenia, which is another term for muscle loss. So if somebody is weak, that creates depression. Depression leads to more muscle loss, and it's all this combination.
Yeah.
That's why you want to diagnose and treat quickly.
And so we'll end with this, sir, and that is, yet again, I have to be honest. I mean, I am above the age that you made mention of, that being 40, to really be concerned about this. I want to make sure our viewers know as well that this is something that perhaps we really do need to take seriously and not just, well, as most men do, sweep it under the rug and, well, look the other way.
I think you're absolutely right. You should diagnose and treat, and you'll feel better, which is a beautiful thing. Men do want to feel better. We do like to throw things out the rug, but if you really understand it, I think we'll take care of it.
Good stuff. Yet again, Dr. Eugene Lipov, researcher, author, board-certified medical director, joining us right here on the Live Zone. Always good to see you, my friend. Make it a great day.
Thank you to see you guys. Have a great day.